In this video, we are joined by sleep specialist Dr. Val, and we are going to be talking about hypnotherapy for sleep. All right, welcome everyone. I am so excited today to welcome my friend and colleague, Dr. Val, the sleep gal. Dr. Val is a board-certified internist and sleep specialist. And thank you so much, Val, for joining me today.
Thanks, Dr. Nishi. So happy to be here.
So Dr. Val, you are a sleep doctor and you're an internal medicine doctor. And could you just tell our audience a little bit about why you got so interested in sleep medicine and also just a little bit about your background and what you do?
Wonderful. Yeah, so I initially wanted to be a primary care physician. I definitely didn't want to be a surgeon. I think in going to med school, you sort of have that route. You're going to be primary care, you're going to be, or surgery or not. I have a family friend who was actually a sleep physician, and I think it was in med school or college. I heard him give a lecture about sleep, and I thought it was super fascinating. What I like about sleep medicine, I can really practice in internal medicine and primary care. In addition to it, I really now focus just on sleep medicine, but there's a lot of lifestyle practices that are really important for sleep. And I think we're going to talk about how sleep is really important for overall health and how it touches really different aspects of chronic health conditions, and that's what a primary care physician does. I also have a background in integrative medicine, so I think of integrative medicine as just my toolbox has expanded. So there's a lot of things that we didn't learn in med school that we can use to help a person sleep better. So I consider myself an integrative sleep medicine physician.
That's fantastic, Val. And I know you just completed editing the integrative sleep medicine book, so congratulations on that.
Thank you so much. Yeah, that was a great project to work on. So got a lot of good authors from academics, from clinical folks as well, just really talking about what are the other tools that we can help our patients sleep better at night.
Now, one of those tools that you are trained in and that you speak about is hypnosis or hypnotherapy. And I get asked this question a lot by my patients with regard to whether or not hypnosis works. Is it legitimate? Oftentimes when people think about hypnosis, they think about the, clucking like a chicken on the stage at a big event or something like this, like a magician or the stage type of hypnosis. But it's actually much more nuanced than that, and there's more research on it. So could you speak to what that is and how it works and how it can help with sleep?
Yeah, great question. So hypnosis, hypnotherapy has really been around for a long time. Since I think the early 1600s, we've seen people using hypnosis, hypnotherapy. I like to use hypnotherapy because I'm a practicing physician and I use it as a therapeutic tool for my patients. Sometimes when we think of hypnosis, we do think of, clucking like a chicken, dancing. They have a show in Vegas about hypnosis, and Hollywood sort of glamorizes hypnosis. But when we use it to treat a specific condition, we refer to it as clinical hypnotherapy. What clinical hypnotherapy is, it's a focused state of attention. So we've all been hypnotized in a clinical hypnotherapeutic state at one time or another. Certainly kids are really good at this. My kids, when they're watching TV, they're really in a trance, right? So I'm trying to talk to them. I'm trying to get their attention, but they're so focused on the TV. So kids are really good at being susceptible, I think, to clinical hypnotherapy or hypnosis. We've had it as well. Like if you're on your phone, you're really focused on something, or if you're reading a book, sometimes you just lose track of time. And really what happens is your brain is really laser focused on whatever you're doing. So the sounds around you, you may not hear people talking to you, and time really bends. Sometimes this happens if you're meeting up with a good friend, you're having lunch, and an hour or two goes by and it can feel like 5 minutes. We say that's a trance-like state, and that's really sort of what clinical hypnotherapy is. So there's different parts to clinical hypnotherapy, meaning there's different steps to get someone into that focused awareness. And so the steps are, number one, building rapport. So getting to know the person that you're talking to. So there's specific questions that you want to ask. When I do it with my patients who need help with their sleep, or maybe they have some claustrophobia with their mask, we initially start out with, what are things that you like doing? What would a perfect day would be like? And certainly we want to make sure that we don't include with our clinical hypnotherapy session anything that could be offensive, meaning if you're afraid of spiders, certainly I'm not going to bring you into a room where you're afraid of spiders. So once we develop that rapport, then I describe what clinical hypnotherapy is, right? So that focused state of attention. There have been studies where we actually do EEG monitoring, so looking at what's going on in a patient's brain waves, and it's actually pretty similar to the stage 1 sleep. It's the theta waves, so helping someone go into theta waves. I say helping someone, but really when you take a look at what hypnotherapy is, it's all self-hypnotherapy. We say hypnosis is self-hypnosis, right? It's getting your brain waves to slow down into a focused state. And in that state, you're really open to a lot of suggestions. And then, that's where the therapy part comes in. It's because, the condition that we're trying to treat. So the way it works is initially you start with rapport. You find out maybe what a person's favorite day would be like, who they're spending it with. I'm based in Hawaii, and a lot of people really enjoy the beach. So sometimes I bring that in. And then you want to use all the 5 senses, right? So as you're, bringing someone into the clinical hypnotherapy type state, right? You're walking on your beach. Are you feeling the sand between the toes? What do you hear? What do you see? Bringing those senses, because really what it is, it's imagining, but with a purpose. So I think that's how kids can really do well with clinical hypnotherapy, because they have really vivid imagination. So imagination and daydreaming on purpose is sort of, I think, a good way to describe how clinical hypnotherapy works. And then part of this process is you go deeper. And so you go to a deeper level of consciousness. And then there's specific clinical hypnotherapy type tools, right, that you can do so. Deep breathing really works. Sometimes another tool is, imagining yourself in an elevator, and then you're going slowly down, and that can help, or going downstairs. Those are different types of deepening exercises. And then once you see from a physiologic standpoint, when someone's really relaxed, right? Their muscles, the shoulders drop, right? Sometimes they have a little twitching of their muscles. And then once they're in that state, then you start to add some of the post-hypnotic suggestions, which for someone who has insomnia, what I like to do is, if they're on the beach, when they're really relaxed, I can see their muscle tone decreasing. Then I say, okay, and then imagine on the beach, there's this, wonderful little cottage. And in this one little cottage, you open the door, and this room is just so pleasant. It's so comfortable. And maybe you see, your bed there, and, you go to your bed. So you're, walking them down the path. It's really pleasant. They're happy. And then you're putting them into the state where then you can add the suggestions, right? You go to your bed, you lie down. It's so comfortable. It's cozy. The minute your head touches the pillow, all your muscles relax. You relax even deeper into restfulness, and then you close your eyes and immediately you fall asleep, right? And it's really just a lot of, honestly, positive psychology, but it's amazing how well it can work. Sometimes I've been quite surprised. I've had patients come in the middle of the afternoon. One gentleman told me that he drank a whole cup of coffee before he came in, and then he felt like, man, he actually could have slept right after if he was at home and if he did this exercise. So it's pretty phenomenal, right? Because you're helping someone get into a state where, for someone who has insomnia, usually people have a hard time relaxing. They have a lot of anxiety, and sometimes they don't think that they are able to. And so part of what clinical hypnotherapy does, it takes a lot of those thoughts out of the way, because you're really focused on just whatever therapy we're trying to help someone with. It's that trance state. Yeah, and it's pretty remarkable.
That's really fascinating. And I think it's just so interesting how you speak about that mind-body connection, that when you're going through this process of hypnotherapy with a patient, you actually can see the physiological changes in them as well. And so when a patient can experience those changes in themselves, it probably gives them confidence as well that they can experience that at home, in their own bed or in their own room, particularly for people who struggle with insomnia and anxiety. So I'm curious, how long is a typical hypnotherapy session, and how many sessions might somebody need if they do experience insomnia or anxiety?
Yeah, that's a great question. And typical clinical hypnotherapy session, what I do in my clinic is 40 minutes. But I have seen, other practitioners do maybe as short as 5 minutes, 10 minutes. I know a lot of dental practices do it because, right, some people go to the dentist and it's painful, it's uncomfortable, the noises that they hear. And you can actually do a pretty fast induction to help someone go deep in, like 2 minutes or even less. Yeah. So it can be quite short. And clinical hypnotherapy, it just depends on what you're trying to treat. Just the way I block off my schedule, I usually do 40 minutes for consultations. And so that's how I block it off. But yeah, it can be, 5 minutes. It can be even longer. So it just really depends on a person's need. And then in terms of how many sessions, I would say, I've seen benefits from one session. I would say at least two would be helpful because sometimes in the beginning, especially if the patient is new to you, it's developing that rapport. And then after the session, it's finding out what works and what doesn't work. A really good question as you're building rapport is just trying to figure out, what type of learner is the person? Are they a visual person? Are they a kinetic person, right? Are they more auditory? And then bringing those in to the practice, to the session. I encourage my patients to actually record the session that we are doing because then they have that at home. To use for themselves, right? Or they can certainly come up with their own script, right, for clinical hypnotherapy. And I think that's even more powerful when you're using the power of your own brain to be able to allow yourself to calm down, to really strengthen the parasympathetic system, the relaxation system. So it is encouraged to practice at home, whether it be through the script that was provided within the session, or there's tons of resources online where you can download scripts for free.
Would you be able to share some of your favorite resources for people who might be interested in exploring hypnotherapy?
Yeah, definitely. So I was trained at the first level of certification through the American Society of Clinical Hypnotherapy. So this is a society that I learned about through my integrative fellowship. And to be part of the society, you actually have to have a professional degree already. It doesn't have to be a physician. You can be a dentist, a psychologist, a counselor as well. Really part of this is because we want to make sure that the person providing the clinical hypnotherapy is licensed and trained in their field. So since I practice sleep medicine, I don't do clinical hypnotherapy for smoking cessation, right? I stay within my scope of practice. I do know some other practitioners who are like pediatricians that have helped kids with nocturnal enuresis, right? So bedwetting. I had heard a really interesting story about a pediatrician who helped someone who had warts. So you think like warts, how can clinical hypnotherapy can help with that? That it really can. So it's really powerful. So I would suggest going to the American Society of Clinical Hypnotherapy to look for providers in the area. You can search by zip code. And if any clinicians here are interested in going to the training program, that is something that I would suggest.
Is there anyone who should not do hypnotherapy in terms of patients or like certain conditions?
Yeah, definitely. And I would say, certainly certain psychiatric patients. So as an internist, as a sleep doctor, I'm certainly not comfortable with PTSD patients. I think what can happen with PTSD, if you don't know them quite well and the type of clinical hypnotherapy that you provide, if it triggers an event for them, that may have an outcome that you are not quite comfortable. If you're not familiar treating that, I would say, work within your scope of practice. So maybe some PTSD patients, maybe some patients who are depressed or clinical and aren't quite stable, probably not helpful to work with. And then maybe some schizophrenia type patients. So I would say, I think in general, people who are open to clinical hypnotherapy, I think there is a thought where, I can't do it or I don't easily get hypnotized. But if you think of what it is, it's if you have an imagination, then you can actually benefit from this. So I think that it has a lot of great usages, but certainly if you have a psychiatric condition that's not controlled, I would suggest to have that, sorted out before you see a clinical hypnotherapist, unless your psychiatrist is a clinical hypnotherapist and they can help you with that.
Great. Well, Dr. Val, that is so fascinating. And so I'm curious, you've spoken about insomnia and anxiety and smoking cessation and a variety of other conditions that can benefit from hypnotherapy. Are there any sleep disorders other than insomnia that can be treated or at least can be helped by hypnotherapy?
Yeah, good question. So nightmare disorder actually is one that can benefit. So with nightmare disorders, as you go through, the script, you can empower people to, sort of switch the script. You can actually change the outcome. So, that's, I think, a really helpful. We talked a little bit about nocturnal enuresis, so bedwetting, that has been shown to be helpful. And then parasomnias as well. So talking about parasomnias, we see a lot of parasomnias in kids. Using different scripts to help with, maybe sleepwalking. Yeah, I would say there's some good evidence for that. Another thing that's not specifically a sleep condition, there is some good evidence to show that clinical hypnotherapy can help with chronic pain, right? So, sometimes you think of pain as just, I broke my arm and it hurts, or I have arthritis and that's why I have pain. But there's a big component of a central pain. Pain can stem from the brain. There's certain centers that can control that. And it's, going through the script with clinical hypnotherapy, if you give someone the power over their pain, I think that's really helpful. And so, research shows that people who have chronic pain can also have difficulty sleeping. So being able to control their pain, can also help result in improved sleep.
So there's so many conditions that actually can benefit from hypnotherapy. So there are a lot of different apps out there for guided meditation and also guided imagery. How are these different from hypnotherapy? And are there people who might benefit from guided imagery versus hypnotherapy? Could you speak about that a little bit?
Yeah, that's a great question. And from what I understand about the difference between the two, it depends on who you're talking to. So sometimes people do use it interchangeably because really they're a form of therapy where the body is relaxing, and the benefits from relaxation are quite vast, right? Once your brain is calmed down, then you can rest, then you can sleep. Anxiety, some mood issues can sort of melt away. Classically speaking, though, hypnotherapy has the specific order, the specific steps, right? You do elicitation, you do deepening. Once that person is in a really relaxful state, physiologically, we think they're in, non-sleep deep rest, right? They're in theta waves. Then you add those suggestions. Guided imagery, guided meditations don't have that specific format. However, listening to a guided imagery MP3 versus a clinical hypnotherapy, I think they're really similar. So, right, because it allows that relaxation. I just think when you're working with someone trained who does clinical hypnotherapy, the deepening may be a lower level of consciousness. However, it's really the same, right? Because once you're in that state, you're not necessarily asleep. Sometimes you can fall asleep, but you can still hear things. You can still wake up. Sometimes it doesn't really matter what the practitioner is saying because your imagination can take you elsewhere. Yeah, so there are definitely benefits to both. And it's just fascinating. I think what I would recommend is certainly to have a practice, whether it be clinical hypnotherapy, clinical hypnosis, guided imagery, guided meditation. And there's certainly a lot of free resources out there, in the App Store, on the Android Store, and then on YouTube that you can check out for free.
Dr. Val, this is just so fascinating, and I think we could go on for hours talking about hypnotherapy and the benefits and the practice of it. But could you maybe share one or two takeaways that you want our audience to get out of this discussion today, or anything else that you want them to know about how to optimize their sleep and mental wellness?
Great question. I would invite you to look into clinical hypnotherapy if you have a sleep condition. Why? Well, there's really no side effects, right? So as compared to sleeping pills, even natural supplements, really once you go through the initial training, the initial session, you can learn how to do it yourself. So my practice, I love to give the free medicine. And, if you have that recording, if you find that good script and you practice it yourself, it does really do wonders. And you may not need medications or supplements to help you sleep anymore. And then also the side effects, right? Feeling drowsy is probably one of them. Yeah, so I think it's a fascinating tool to have to help improve your mental health, your emotional state, and then your overall sleep.
I love that. I mean, I'm a huge proponent of using therapies that don't have side effects, and there are many out there like hypnotherapy that are very effective and also evidence-based.
Yes,
Yep.
agreed.
So I agree with you. Yeah, I really invite people to kind of to explore those modalities that might seem like they're a little bit out there, but are actually very effective. Um, what about a tip for physicians or healthcare providers? Is there anything that you would want to share with that audience?
Yeah, I think same thing. If this is interesting to you and if you want to explore it further, honestly, it was a weekend course for me. I went to Seattle in 2 days. I was able to learn how to do it. Certainly, just with meditation, any type of practice, the more you do it on yourself, I think the better it helps your patients. But really, it's all about finding tools that are low side effects that can really help our patients. And so clinical hypnotherapy is certainly one of them. And you don't necessarily have to do it yourself. You don't have to go to the training program. Find a practitioner in your area. I'm sure there's, multiple out there.
Well, Dr. Val, thank you again for being here today. This was just fascinating. We have a special event coming up together. Would you like to share a bit about that?
Sure. We're putting a workshop together for women's health and women's sleep. It'll be on November 10th. I'll be speaking about women's hormones and sleep. Dr. Nishi will be there as well. And we also have two other colleagues, Amanda and then Dr. Smita, who will also be providing their insight about how you can sleep better. Hope you join in.
So our workshop is going to be on November 10th, and we're going to be talking about all things sleep and wellness. If you're interested, you can click on the link in the video description below, and the link will be also on the screen here, and you can sign up for our waitlist to learn more. Dr. Val, where can people find you if they want to learn more about hypnotherapy or just learn more about ways to improve their sleep?
Oh, thank you. I have an Instagram. It's valerie.cacho.md. And then if you're on TikTok, Dr. Vals, Sleep Gal. And then for patients, I'm licensed in Hawaii as well as California. And my website is www.sleeplifemed.com.
Fantastic. Well, thank you so much.
Thank you, Dr. Nishi. Such an honor to be here. So happy that we could do this together.
Thanks.
Bye-bye.